Bryan Betty, who's a member of New Zealand's COVID-19 Technical Advisory Group and also the director at the Royal New Zealand College of General Practitioners, and joins us now from Wellington. Good to have you on the programme once again. Last time we spoke, I remember you saying we have to wait and see to see what Omicron does and the information that comes out. We're hearing from South Africa that they're seeing a mild response in patients, but how reliable an indicator is South Africa's experience for the rest of the world?
Oh, look, I think it gives us a good guide as to perhaps where this is going. I think it really is still an unfolding picture. We're still very early on in terms of what's happening, but there is no doubt the experience of South Africa with 78,000 patients, this new study points towards, is really suggesting, yes, it might be milder in terms of symptoms. However, the vaccine still does seem to give some protection. However, what we're seeing is this very, very rapid spread of Omicron, which I think at the end of the day will probably start to displace Delta around the world. And it's the sheer numbers that could be an issue, especially amongst unvaccinated, for hospital systems around the world.
Okay, but just to go back to this point, the message that it is mild, is that not maybe causing mixed messages for maybe people to put down their guard? Dr. Tedros himself has said it's wrong for people to consider Omicron as mild. The chief medical officer of Moderna has also said that. So should that messaging, I'm not saying negligence is the word, but just, be careful, because people could put down their guard.
I actually agree with what you've just said on this, that although that has been said about Omicron, the fact of the matter is what we are seeing, those patients that are potentially at risk from COVID are still potentially at risk from Omicron. And those patients that are not vaccinated are still at risk. So there is real concern. And we get to the sheer numbers, that is the way this is spreading and the number of people it's spreading to, you start to see that there is a real problem here that we cannot ignore. We need to keep the focus on what's happening here. And we also need to focus on vaccination. We cannot let our guard down here because of what is happening here. So, yeah, I think we do have to be careful about how we describe Omicron going forward.
And let's talk about travel bans. The UK has stopped will be stopping its travel ban. What do you make of that? And do you think other countries could follow suit?
Oh, look, I think so. Look, we have so many measures that now in place, from where we started Delta to where we are, started COVID to where we are now. I mean, we have a vaccinated population. We do have things like vaccine passports. We have things like rapid antigen testing. We have nasal, pharyngeal, PCR testing. There is a range of modalities we can use to limit the spread of this virus without blanket bans on travel. And I think we have to think about this. We have to think about the way we can free up travel, because it is very, very important. But there are certainly measures in place we can put in place to do it safely. And I'd expect other countries to start to follow suit over time.
And just very quickly, yes or no, do you think New Zealand will drop their travel ban?
Look, there's a lot of talk about that at the moment. Certainly, we're looking mid-January, probably with free flow across the Tasman again and some of the Pacific Islands. There's a lot of discussion about what this looks like in the next 3 to 4 months.
Okay.
We would hope we start to reconnect with the world. We've got a population that's about 90% fully vaccinated now.
Yeah.
So I think we will be moving into this phase very quickly.
All right. Thank you so much. Bryan Betty from New Zealand's College of General Practitioners. Thank you so much.